Today's video topic is: what are the symptoms of a sports hernia? Sports hernia is a common injury among athletes and people who engage in high-intensity physical activities. It is a type of groin injury that can cause discomfort, pain, and swelling in the lower abdomen and groin area. While it's commonly seen in athletes, sports hernia can also occur in non-athletic individuals. Here's what you need to know about the symptoms of sports hernia. What is a sports hernia? A sports hernia is an injury to the soft tissue in the groin area that causes pain and discomfort. It is not a true hernia, as it does not involve a protrusion of an organ or tissue through a hole or weakened area in the abdominal wall. Instead, a sports hernia is caused by a tear or strain in the muscles, tendons, or ligaments that support the groin area. Symptoms of sports hernia. The symptoms of sports hernia can vary from person to person. Some people may experience mild symptoms, while others may have more severe symptoms. The most common symptoms of sports hernia include: 1. Pain in the groin area. The pain may be felt on one or both sides of the groin and can range from mild to severe. 2. Discomfort when bending, twisting, or turning. Sports hernia pain is typically aggravated by physical activity that involves these movements. 3. Weakness in the groin. A sports hernia can cause weakness in the groin area, making it difficult to engage in physical activity. 4. Swelling or bulge in the groin. Although this is less common, some people with sports hernia may experience a visible bulge or swelling in the groin area. 5. Pain that worsens over time. If left untreated, sports hernia pain can worsen over time, making it increasingly difficult to engage in physical activity. Diagnosis and treatment of sports hernia. Sports hernia can be diagnosed by a healthcare professional through a physical examination, medical history review, and imaging tests like MRI or ultrasound. Treatment typically involves rest, ice, and physical therapy to strengthen the muscles and tendons in the groin area. In some cases, surgery may be necessary to repair the torn or strained tissue. Preventing sports hernia. While sports hernia is a common injury among athletes, it can be prevented by taking the necessary precautions during physical activity. Some tips to prevent sports hernia include: 1. Warming up properly before physical activity. 2. Engaging in strength training exercises to improve muscle and tendon strength. 3. Avoiding sudden changes in direction or quick stops during physical activity. 4. Wearing appropriate protective gear, such as a groin support or compression shorts. 5. Maintaining good overall physical health and fitness. Conclusion. Sports hernia is a common injury that can cause pain and discomfort in the groin area. Symptoms of sports hernia include pain in the groin area, discomfort when bending, twisting or turning, weakness in the groin, swelling or bulge in the groin, and pain that worsens over time. If you suspect that you have a sports hernia, seek medical attention immediately. Treatment typically involves rest, ice, physical therapy, and in some cases, surgery. With the right prevention techniques, you can reduce your risk of developing sports hernia and enjoy physical activity with confidence.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.